I am Dr. Rufino Aguilar Bartolabac, running for President of the Philippine Medical Association, or PMA. Imagine a world where every patient gets the care they deserve, where healthcare is top-notch and accessible to all. That's the world I envision for our medical community. And I need your help to make it a reality. I'm not here to spout fancy jargon or make empty promises. I'm here to roll up my sleeves, get down to business, and work side by side with every one of you to bring positive change in our field. Together, we can elevate our profession, advocate for our patients, and make a lasting impact on the health and well-being of our communities. Join me in aspiring to create a brighter future for healthcare by embarking on this journey with a 7-point agenda. First, let's passionately pursue the PMA mission to enhance benefits and professional growth and safeguard medical rights. The PMA board, united as one, must brainstorm innovative ways to increase member benefits, especially in remote areas, to reduce preventable deaths. By doing this, we aim to eliminate the tragic reality of many Filipinos dying in underserved regions. We can create a future where Filipino doctors thrive at home, keeping families together and building a healthier nation. Ituro mo sa akin ang isang malusog na bansa at ituturo ko sa iyo ang isang bansang maunlad. Second, the PMA, the highest legally recognized Physicians Association, must elevate its prestige and authority. This requires a thorough review of the Constitution and a revitalization of its mission. As a provinciano, I am passionate about supporting general practitioners, our health's frontline heroes who often serve with meager resources. Once, a grateful mother gave me a live chicken as a humble token of gratitude after I saved her child's life with the help of God. As she handed over the chicken, it laid an egg before my eyes. Whilst at a grocery store grabbing bread, I scored an unexpected discount. No senior perks yet, and I was in my 50s. The young owner, likely in the 30s, stood over and quipped, "Doktor, kaya binigyan kita ng discount ngayon kasi nang noong maliit pa ako, lilibre mo ako sa tuli." I have loads of amusing tales like this from my time as a doctor in the province. I am gearing up to supercharge our small-town colleagues into top-tier family doctors. A special CME program focused on expanding their capabilities is in order. We will bring these special CME projects to the barrios. Again, this will need specialist colleagues' expertise and reinforcement, and I seek their support. Third, with medical knowledge evolving fast, what was the gold standard a decade ago is now yesterday's news. Let's not forget our core duty as healers. About 1 in 5 Filipinos face poverty, more so in rural areas. Health troubles don't discriminate based on income. It's a big puzzle, but we can lend a hand working alongside our body, the health secretary, to crack it. Although the solutions may lie beyond the PMA's domain, we should strive to within the association's capabilities to assist the government. Fourth, it's a big dream. Picture a medical oasis on the vacant PMA grounds, a cooperative hospital run by, for, and of PMA members. Thanks to our ethical code, professional fees waived other than full health payments for PMA families, funded by pooling resources from our forthcoming 100,000 strong community. Imagine each member investing 10,000 pesos. Billions can be raised to make this hospital a reality. With a cooperative spirit, top-notch medical care will be accessible, tackling the burden of costly diagnostics for PMA members. The Cooperative Medical Center will give hefty discounts to PMA members, making care affordable. The PMA Medical Center, a hub of success, will rise without losing any PMA property, doubling as a cost-effective venue for our gatherings. By setting aside 10% of professional fees, we'll expand to regions and provinces supported by local PMA groups through smart scaling will slash drug prices, diagnostics, and services costs, ensuring all PMA members can access to top-notch care. Fifth, to uplift the image of the PMA, it must form a robust partnership with the Department of Health to enhance healthcare services for our people. Collaborating closely with the DOH, especially during emergencies, will amplify the PMA's impact, utilizing its workforce and resources effectively. My leadership style is participatory, prioritizing listening to all voices during meetings. With most grassroots PMA members hailing from the provinces, their perspectives must always be valued, as the best ideas may originate from them. They should lead, and the leaders should serve. It's crucial to understand their aspirations by prioritizing service to the masses and the provinces. Having a provincial doctor as the PMA president would allow us to address these needs better. A provincial doctor of ages past is now poised to lead as a servant leader, fueled by a relentless drive to propel the Philippines toward progress to the noble art of medicine. By pasturing the health of the provincial masses, we not only fulfill a noble cause, but also elevate the PMA's stature in serving our people. 6. One of the principles of good governance is transparency, which is also one of my advocacy principles in running an organization. Thus, I advocate for sharing corrected minutes of PMA board meetings with component society president and secretaries. This will keep our members in the loop, empowering them to engage with ongoing PMA activities. Let's embrace democracy at its core by getting involved and ensuring every voice is heard. Let's tackle the low turnout in PMA national elections by promoting inclusivity over exclusivity. Say no to monopoly and let democracy reign. 7. The recent directive mandating PMA members to deposit their annual dues directly into PMA bank accounts is unconstitutional. The PMA Constitution specifies that membership flows to recognized component medical societies, indicating that dues should be channeled through them, not directly to PMA. It's unjust to penalize all component society treasurers due to the actions of a few. It's like burning down the whole house to eliminate a few rats. The key is to enforce bonding for all individuals handling organizations' funds as per the association's guidelines to address this issue. We've got the skills, the passion, and the heart to revolutionize healthcare and set new standards of excellence. Let's band together, harness our collective energy, and show the world what we're made of. I may not have a magic wand or a crystal ball, but I have a vision. Not just good, but downright legendary. Picture a world where stethoscopes are like magic wands, where scrubs are our superhero capes, and where every diagnosis is a chance to save the day. I believe in us. I believe in our potential. And I believe that together we can achieve anything we set our minds to. Let's roll up our sleeves, get to work, and make magic happen in healthcare. I believe in the power of laughter, the strength of unity, and the joy of making a real difference in people's lives. Together, we can be the Avengers of healthcare, the Justice League of healing, and the X-Men of compassion. We might even give Batman a run for his money. Lastly, let's shape the PMA we envision by joining me in supporting my 7-point agenda. Mga minamahal kong doktor sa PMA, iniaalay ko po ng buong puso ang aking sarili sa pagsilbi sa inyong lahat. Mabuhay mga Pilipinong manggagamot! Mabuhay ang PMA! Salamat po!